Fine, fine, thank you.
Yeah, great to have you back.
Can you hear
Dr.
me?
Yes, we can. We can hear you. And hopefully today we can learn how to safely listen to webinars and generally everything. Personally, I've been looking forward to this session. I was excited to hear you're the one doing it because you've been quite a good presenter. So again, ladies and gentlemen, those who don't know, Dr. Lilian Moka is an ENT surgeon from KU, Teaching Referral Hospital. She's going to talk about safe listening. Thank you.
So good afternoon, everyone. Thank you so much, Amina, for the lovely compliments. It's nice to hear that I have been making a difference. Today, I'll have my presentation being projected. And for those of you who are new, my names are Dr. Lilian Moko. I'm an ENT surgeon at Kenyatta University, Teaching Research and Referral Hospital. I am also a member of the technical working group working for the Ministry of Health, working on the National Strategy for Ear and Hearing Care and Guidelines 2023 to 2028. So today I will be making a presentation on Make Listening Safe. This is a WHO campaign. Next slide, please. This is a WHO initiative that came up as a result of a concern due to the rising exposure to loud sounds, especially in recreational settings on our day-to-day life. So the aim of this campaign was to realize a world where people of all ages in the world can enjoy recreational listening without putting their ears or their hearing in danger. So the risk that has currently been noted is that there are 1 billion young people at risk. When you talk about young people, we are talking about people between 12 to 35 years, and this is due to recreational noise exposure. 50% are at risk due to use of personal listening devices, and 40% are exposed to damaging loud sounds either at clubs, at discos, at bars, in the gyms, and sometimes even in the workplace in our day-to-day life. So the trends are also increasing as we have more and more technology. You notice we now have a lot of online games, a lot of online interaction in terms of online meetings, in terms of online meetings and online video games or PC games that have led to an increase in the use of personal listening devices, hence an increase in the risk. Next slide. So the WHO looked at this in terms of 3 aspects. The 3 aspects are the aspects that are aspects of making listening safe. That is making listening safe in an occupational, just 1 minute.
Dr. Lilian, I think you're on mute. We can't hear you.
Oh, sorry.
Yeah.
The slide is not complete. You can press next. So the World Health Organization came up with 3 main aspects of making listening safe. The first one is the use of the first one is making listening safe in an occupational settings, and then there's use of making listening safe in occupational settings, and making listening safe in environmental
the environmental spaces and noise exposure. Next slide. So when we talk about safe listening, we must first understand what noise is. Noise is definitely sound, or noise is described as sound that is unwanted, unpleasant, very loud or loud, and disruptive to our hearing. So when we talk about safe listening, we want to look at noise in the aspect of the duration, that is the duration of time that you're exposed to noise, the intensity, and the frequency of exposure. So if you want to be a noise listener, you have to look, if you want to be a safe listener, you have to moderate the amount of noise you're exposed to, you have to moderate the duration of time you're exposed to it, and the frequency of exposure. So the chart on the left is basically showing us the different levels of noise and the different things that we are exposed to in our day-to-day life. So for example, you can see a noise of around 100 decibels. We're talking about noise made by a lawnmower. When we talk about 80 decibels, that is noise that is found in a town when there is busy traffic. When you talk about 50 to 60 decibels, that is noise that is in the conversational level. Now, the higher the higher the intensity of sound, the more dangerous it is. Now, the highest level of safe noise exposure is usually quantified scientifically at 85 decibels in a period of 8 hours. That means that you should not listen. If you are to listen to the maximum amount of noise, you should listen to 85 decibels, and it should be for a period of 8 hours. For safe listening, as above 85 decibels, as it increases, usually the time drops, or the duration of time exposed to it drops considerably. So for example, 100 decibels, you can only listen to a maximum of 15 minutes before you cause damage to your ears. And something like 150 decibels can be listened to for a maximum of 2 minutes. Next slide, please. So when we talk about noise-induced hearing loss, this is the hearing loss that comes as a result of exposure to harmful noise. This can be either sudden exposure or exposure over a certain duration of time. Now, it is one of the leading causes of preventable deafness worldwide. That is together with infections, and it is usually a reversible and permanent type of damage that occurs to the ear that can either be rehabilitated using hearing aids or cochlear implants. Now, there are some risk factors such as genetic predisposition, diabetes, hypertension, and smoking that might increase an individual's risk of developing noise-induced hearing loss. Now, this picture shows us the anatomy of the ear. If you remember very well, we have been discussing it. The ear is divided into 3 parts: the outer ear, the middle ear, and the inner ear. So the sound usually is collected by the outer ear. You can see it is shaped as a funnel, and it usually directs it into the eardrum. Once sound reaches the eardrum, it causes vibration, and the vibrations also are transmitted through those 3 small bones, which are the ossicles. They in turn vibrate and transmit or change that sound from into kinetic energy or into vibrations that are transmitted into the inner ear. That is basically, and as they are vibrating, they also cause some form of amplification. And once in the inner ear, the fluids of the inner ear transmit the sound and cause the movements within the organ of hearing. Now let us see in the next slide what happens in terms of excessive noise exposure. Now, if you're exposed to noise for a long duration of time, the first thing that happens is that I have to say that if you're exposed to very loud sounds suddenly, those sounds can cause, if there's a significant change in the pressure, they can cause damage to your eardrum, your ear ossicles, and the structures of the inner ear. That is due to the mechanical trauma that will be caused by the pressure of that loud sound. However, if you expose yourself to loud sounds, usually what happens is first you get a temporary threshold shift. Now, these images are images that are showing us the inner ear. And the inner ear is usually the organ of hearing is the one that is in detail here, and it is mainly composed of hair cells. Those hair cells are divided into outer hair cells and inner hair cells. Now, noise causes damage to the outer hair cells. The outer hair cells act as the amplifier of the ear. So the outer hair cells regulate sound. For example, if the sound that is presented to the ear is too loud, the outer hair cells are the ones that regulate that volume just as the amplifier, so that you're able to hear the sounds, one, very clearly, and secondly, you're able to hear the sounds at a level that is not painful, even if it is higher or it is supposed to cause you some pain. So what happens is that is the function of the outer hair cells. So when you're exposed to noise, you develop what we call a temporary threshold shift. This is due to repeated damage as a result of overworking outer hair cells. So this damage leads to inflammation. The outer hair cells, as you can see there, they are connected to the cochlear nerve. So there's inflammation between the junction between the cells and the nerve. That inflammation, there's also release of some oxygen reactive species that leads to what most of us interpret as a temporary threshold shift. It is a feeling of ringing in your ears, or a feeling of fullness, or a feeling of muffled sound. Now, most of the times, this corrects within 6 hours and to a maximum of 10 to 14 days after noise exposure. If you repeatedly continue exposing your ears to noise, the repeated inflammation and damage at the junction between the outer hair cells and the nerve cells leads to repeated healing, repeated inflammation with fibrosis, and this is going to lead to a permanent threshold shift, meaning there will be permanent scarring, there'll be permanent irreversible change, and this is what leads to now noise-induced hearing loss that has a characteristic pattern. When the audiologist does an audiogram, you're going to see it at the end of the presentation. And this hearing loss is also symmetrical because you present noise, you cannot choose which ear is going to be exposed to noise and which one is not going to be exposed. So mostly it is symmetrical and it is permanent. So next slide is going to tell us the 4 main signs. So as I said, there's repeated inflammation. And this repeated inflammation leads to fibrosis, which leads to permanent damage between the outer hair cell and the cochlear nerve. So it gives you a sensorineural type of hearing loss. So these patients will present with difficulty in hearing normal conversation, especially in a noisy environment. Tinnitus, a very common complication or a very common symptom of people who are exposed to noise. That is a ringing sound in your ears. Asking people to hear themselves, so loss of clarity. You lose mainly the higher frequencies of sound before you go to the lower frequencies due to the arrangement of the cochlea anatomically and the frequencies. And so because of this, you find that most of the times you're not able to appreciate high frequency sounds, things like doorbells, things like alarms, people with high pitched voices. This is where you find for example, wives bring their husbands to the hospital and they say their husbands ignore them all the time because they're not able to hear the high pitch. And also asking people to repeat themselves clearly. You're mainly not able to appreciate consonants. And consonants are the ones that help us to be able to discriminate sound. So for example, if you tell a person with a noise-induced hearing loss that you're going to sell some shells, they will not be able to differentiate the S and the SH. So next slide. And so most of them, they come with complaints like, I'm not able to understand what most people are telling me. So we said that WHO is looking at the safe listening initiative in 3 aspects: in the aspect of occupational, non-occupational noise exposure, and the environmental noise exposure. So in terms of occupational, occupational noise-induced hearing loss is when a worker is exposed to more than 85 decibels of sound in an 8-hour period. So in our setup, we have these workers are mainly both in the formal and in the informal sector. We have people working in factories. We have people working in hospitals, especially those working in units that have machines with monitors and constant beeping. We have people who are working in the informal setup, jua kali, industry, people in the markets. So these are the people who are at risk of noise-induced hearing loss. It is one of the leading causes of preventable hearing loss, and there's a very high incidence in the middle to low income countries. This is due to poor legislature, poor laws, and also due to lack of guidelines on use of noise protective gear while at work or in the workplaces. So other than the fact that the work itself or being exposed to noise at work is a risk factor, other risk factors that may make an individual get noise-induced hearing loss compared to others are things like having more frequent and long-term exposure, perhaps even having exposure to noise both at work and both in the recreational facilities, genetic susceptibilities, a male and older age. If you're a male and you're older and you're working in a noisy environment, you're at a higher risk of developing noise-induced hearing loss. Lack of appropriate hearing protection. People who are working in factories where there is exposure to noise and there is also exposure to solvents. Some solvents, such as the dye, some dyes are particularly, they cause noise-induced hearing loss by the fact that that solvent, the chemical substance, can diffuse into the ear and cause a permanent hearing loss. And also people who work in environments where noise is amplified. That is offices that are not acoustically fitted to absorb noise. Next slide. So the next slide, so how you prevent this is you want first, there are technical measures such as reduction of noise at the source. So people making sure, or factory owners making sure they buy machines that have the sound protection engineering measures in place that make sure that the machine emits minimal amount of noise and that is protective to the human ears. There's reducing noise propagation by considering acoustics in the factory stage. So you can have some factories, especially in low and middle income countries. WHO is advocating for factories to be constructed with material that can absorb sound so that they can protect the ears of the workers. Having locations within the factory where there is minimal noise exposure. These are mainly for workers to have quiet breaks so that their ears can rest. Use of personal hearing protection. You can either use earplugs. Earplugs reduce noise by 15 decibels. You can use earmuffs. Earmuffs are the other ones that are put on top of the ear and they cover the entire ear and provide a seal and they reduce noise by 30 decibels. There's also introduction of public health programs and legislation laws that force or enforce hearing conservation programs. So in the next slide, when we look at a hearing conservation program, there are certain things that must be there in a hearing conservation program, and this is something that we, as a technical work group, while coming up with the guidelines, we thought that this would be a mandatory recommendation for governments and unions to make sure they are advocating for hearing conservation programs in the workplaces, especially in places where workers are exposed to noise. So as a compulsory requirement, this program should have baseline and annual audiometric testing of workers. They should provide, the company should provide hearing protection and attenuation of the hearing protection devices. They should provide frequent training on the risks of noise exposure and how to protect yourself from noise. They should also post the OSHA noise standards and teach the workers how to measure the environmental noise levels and how to protect themselves. And it should be a program that has efficient record keeping so that we can be able to track and have data for epidemiological and research purposes. So next slide. So that was for occupational noise exposure. For environmental and recreational noise exposure, I've combined the two because this is noise that we come across in our day-to-day living. Most of the times we actually do not think about it as noise. We probably think about it as normal life. So some of the sources of noise that have been considered to be harmful are toys. There are these toys that have very high frequency sounds that we are giving our children. They spend a lot of time playing with them. They're battery powered. They're a source of noise that can be harmful, especially because some children put them near their ears while they're playing. Gadgets and tools in the household, mainly things such as the mixers and the blenders and the lawn mowers that we use at home. Personal audio devices. These are the devices that we're using at home, the mobile phones, the earphones, the Bluetooth speakers, the video gaming materials, public roads and traffic. If the average noise that has been measured to be present in traffic is 85 decibels. So if you find yourself sitting in traffic for 8 hours, that is for more than 40 hours in a week, then you're probably exposed to harmful levels of sound. Also, public transport. We have public transport users. There's a lot of noise pollution in the public transport, in the matatus, from the music and from the noise in the surroundings. Hospitals, sporting and entertainment venues, including gyms and public ceremonies and events. So all this has been proven or has been shown to be a public health problem that is emerging. So the CDC conducted a survey in the US, and this survey reported that 50% of the cases of hearing loss, this was in 2014, were exposed to noise at home and during daily activities. So this is something that is of concern in the developing world, and it is also going to be of more concern in the developing. Sorry, it is of concern in the developed world, and it is going to be of concern in the developing world. Next slide. The main population that will be that are mainly affected by the recreational noise level are mainly the youth, because they seem to be exposed to all the risk factors or they're exposed to all the sources of recreational noise. So to prevent or to reduce noise exposure in recreational settings, you have to employ three main principles. The first one is to reduce the sound intensity of whatever gadget, of whatever gadget you're using. Reduce the duration of exposure. Usually we say, or WHO recommends, that you minimize exposure, especially when you're using personal listening devices, to 60 minutes, and increase the distance from the source of sound. So for example, if you're in a concert, you don't have to sit next to the speaker. You can make sure that the speaker is far away from where your ears are. So to reduce sound intensity, you need to identify the safe listening levels. Currently, most gadgets have a safe listening level, including our televisions at home. If you're using an updated gadget, most of them in Kenya are now complying to the WHO and the International Telecommunication Union standards, and they have that. Smartphone apps, you can use smartphone apps that can measure your environmental noise, and these apps can be able to limit and to regulate. If you're using the gadget to listen to something, it will regulate the volume for you. If you're using the gadget or the app to measure environmental noise, it's able to give you a warning if the noise level goes above the recommended levels. Also, use of earplugs in clubs and noisy environments. Currently, in the European Union, most of the countries, especially in Netherlands, they're utilizing, and in Switzerland, they have the safe listening mechanisms where they are now encouraging people in the clubs to wear earplugs. or even in noisy environments so that they reduce the amount of noise that they are exposed to. And now we have studies that are actually showing that the quality of sound or the quality of music does not change even when you use an earplug. And so you should not be afraid to go ahead and use an ear club. It is not going to interfere with an earplug in a club, as it will not interfere with the quality of sound. You can also use earplugs or move away from the source of sound. Next slide. So you can, another form of prevention is by limiting the duration of exposure. So you can also monitor the noise exposure. The picture on the left is showing us 2 sound level meters. The first one is a commercial device that can check the environmental temperature, pressure, and it also gives you the environmental noise levels. The other one is a smartphone that has an app in it that is called a sound level meter app. If you go to your app store, you'll be able to download it, and it comes even in many different names, including the Decibel app. And this is an app that is able to monitor the environmental level of noise that you're exposed to and give you warnings if you have been exposed to very high level of sound. These devices and apps also give you alerts and warning signs, and most of the electronics nowadays have complied to the WHO ITU, that is International Telecommunication Union, global standards for safe listening. That is for most personal and household devices that are currently being produced. Next. Next slide. So I decided to add this slide that is generally just outlining the 3 standards. So when we talk about the WHO ITU standards, these are standards that we should all be aware of. One, there are just 3 major standards. Every device should measure the listener's use of sound allowance based on 2 models. So if you go to your device in your sound settings, mainly for the mobile phones, and for most gadgets, to check if your device is complying to the ITU standards, it should give you 2 modes of use. Mode 1 is for adults. So it measures and allows you to listen to 80 decibels for 40 hours per week, a maximum of 80 decibels for 40 hours per week. And then there's mode 2 for sensitive users. Sensitive users are people who already have a hearing impairment, people who are old, and children. And these ones, it limits the use to 75 decibels for a 40-hour period. The second standard is that each device shall include options for volume limiting and parental volume control. This one is mainly because of the fact that there are so many young children and underage children who are listening to devices, and they may not be able to control the volume. So this is to allow volume limitations and parental volume control, especially for young listeners. The third standard is that each device shall provide the user with personal usage information, general information on safe listening, and warnings and cues with personalized messages. Most of our gadgets have this feature. Some of them, even in the Apple phones, they can be found in the health section. For some of them, it is found in the settings section. Also, if you install some of the listening apps, they will come with the standards within itself. It's like a built-in feature within the applications. Next slide. You can check out your televisions at home and any other gadget, including the PlayStation, that gives you exposure to sound, especially if it cannot connect to Bluetooth or to headphones. Now, this slide is mainly outlining the WHO standards for safe listening in venues and events. These are mainly places such as clubs, discotheques, concerts, public events such as weddings, churches, ceremonies. And the WHO has outlined 6 key modes or 6 key standards for ensuring that there's safe listening amongst these 6 main standards for safe listening. So the first standard is limiting sound levels. So WHO encourages sound level to be limited to 100 decibels. This is mainly for public functions, people who are having weddings. This can be adjusted according to the location. This is something for sound engineers. It can be adjusted according to the location, according to the number of people attending the event, and according to the environment where the event is being held. The second one is monitoring sound levels. So there should be continuous monitoring of sound levels, especially if you're using gadgets that are changing the volumes. There's volume fluctuation. For example, if you're in a kesha and there are different instruments, or if there's a live band with different instruments. So continuous monitoring of the sound level to make sure that they are not exceeding the recommended level of sound. There's also optimizing venue acoustics and sound systems. There's a whole booklet with guidelines on how to set up sound in public events, especially the guidelines to comply with under WHO, talking about the location of the speakers. They should face away from the people. They should be approximately 6 meters away from the listeners. And if preferable, you should put them up compared to putting them down or at the level of the listeners. Next slide. The fourth one is making personal hearing protection available. So WHO advocates for the owners of clubs, any person holding a concert, to make people aware that the sound that they're exposed to is harmful. And so they should provide personal hearing protection in form of mainly earplugs. This is already something that has been enforced. This is a law that has been enforced mainly in the Scandinavian countries. Access to quiet zones. Most of the clubs also in the European and in the US currently are having quiet zones where members of the audience are allowed to take a break so that they can give their ears a rest. We talked about listening to loud sounds for a maximum of 60 minutes. Now, if you reach your 60 minutes, you should take a break. So every hour you're listening to very loud music, you should take a 15 minutes break in a quiet zone so that you can allow your temporary threshold shift to at least recover before you can expose yourself to noise again. Still remember, continuous exposure puts you at greater risk. There's also provision of information on the hazardous effect of noise. This is mainly to create awareness so that people can make informed choices. If you choose to expose yourself to harmful noise for a longer duration of time, you already know that the consequences that you will face as a result of that. So a lot of advocacy in form of training, in form of information dissemination. Next slide. We also advocated in the guidelines, there's also the advocacy for school-based hearing conservation programs. These are mainly targeting the adolescents and youths. These are the people who are also at a greater risk of developing noise-induced hearing loss due to the fact that they're going to have exposure across their life course. You can imagine a child who was born in this age and era of technology. So they play with smartphones, they play with digital toys that produce a lot of sound. As they are growing up, when they become adolescents, they play a lot of video games, they're exposed to sound. And again, they go to work, they use a lot of the headphones, they go to the gym, all this. So the school-based hearing conservation programs are mainly to change the listening behaviors of young people, and they're mainly to utilizing the health belief model. So we believe that if you teach these young people from a very young age the hazardous effect of noise, provide them with educational material, then they will be able to understand the risk of noise, and thus they will be able to have safer listening behaviors. So that was among our last slides, and it was talking about the school conservation programs, and those are the things that are necessary in or we have put in the guidelines for school hearing conservation programs. We have also put into consideration provision of amplification and assistive devices for schools, especially where there are children using hearing aids, and environmental modification of the school environment so that it can be quiet, so that there is very little external interference in terms of noise from the surrounding community, so that we can be able to optimize the learning environment. Next slide. So all those are the different aspects of safe listening. And safe listening is something, it is a campaign that mainly is going to achieve its objectives through advocacy. So the main question is, what is the role of primary healthcare workers? So our role as primary and even secondary and tertiary healthcare workers is to increase awareness on the damaging effect of noise, especially in the patients or in our day-to-day lives in the communities. Once you have this information on how even people should protect themselves, then you should go out there, let people know their phones are also capable of protecting themselves. The gadgets the children are using, they can be able to put a limit and parental control, and so we can be able to have a society that is employing safe listening practices. Also, our role is to measure noise levels. You can measure the noise levels that are around you in your environment and check whether they are beyond the recommended measures, and you can be able to give the necessary guidelines or the necessary instructions to people around on how to protect themselves. You should encourage regular screening, especially if you come across somebody who is at risk of developing a hearing loss. If you have a diabetic person who works in a factory, they should have regular screening because you know they are at greater risk. If you have a hypertensive who works in jua kali, you should encourage them to have regular screening. Same if you have a woman who works in a noisy environment like in the market, and she has either diabetes or hypertension or both, you should encourage them to attend regular screening because it puts them, the noise they are exposed to daily puts them at a greater risk. And even having the comorbidity is an even greater risk. We should be able to catch the early signs and symptoms of noise-induced hearing loss. The most common is tinnitus. Any patient who comes to you with tinnitus should be referred to an ENT because that is a warning sign, especially if they're exposed to noise, especially in recreational settings, so that they can undergo screening and they can also undergo training and teaching on safe listening practices. So our last slide is on, the next slide is that, those are my references. And finally, the last slide is an audiogram. The next slide, please. This is an audiogram showing early noise-induced hearing loss. I said it has a characteristic. So if you go to an audiologist and they check you for noise-induced hearing loss, there's a characteristic dip or notch at the 4th frequency, and there's a loss in the higher frequencies. That is from 4th frequency at 4,000 kilohertz and above. So this is the pattern. If you do an audiogram and you see this, or if a patient presents to you an audiogram that looks like this, that is diagnostic of noise-induced hearing loss. So that is the end of my presentation. I hope it was not too mouthful. It's a bit complex. It's a bit complex a topic. Thank you.
No, Dr. It was perfect. You made it quite clear and you're quite elaborate in your explanation. Makes perfect sense. Thank you very much for that. So I'll just jump quickly to some of the questions, and the one that has appealed mostly is the one from Saumo Wayua. Good afternoon. Hospital noises, especially in the ICUs and other care areas where the machines generate this continuous beeping sounds. How much effects can these sounds have on the patient's hearing, and especially newborn babies admitted in ICU, and how can we protect them? But I'll go further and ask for the staff, because I can imagine how long the ICU staff stayed in there.
Okay, so yes, I think hospitals was one of the places where I mentioned it is both a source of noise for the patient and for the worker. So I mentioned both when I was talking about occupational and noise-induced. People, especially who work in dialysis units, in ICU, and in theaters, have been shown, and dentists also, people who also are in dentists, people in occupational therapy, and people in maintenance departments. Those are the people who are exposed to, or whatever they do in the hospital exposes them to either machines, beeping sounds, or continuous noise from the machines that they use in their work. It has been shown that they develop a hearing loss. They are at risk of developing hearing loss. In terms of how to provide them for the patients, usually we consider the risk of the disease that puts them in the ICU vis-a-vis the risk of developing a hearing loss, which can be rehabilitated. So there is nothing much we do for the patients. For the babies, what we do is that all patients who have gone to ICU, including newborns, are considered at high-risk patients for hearing loss. And these are the patients who are followed up with frequent screening methods upon discharge. However, this is something that is going to be new as we enforce our strategy and guidelines. Their follow-up of these patients is going to be started, or is going to be implemented, because it's not a routine practice currently in our country. For the workers, I think they should do a baseline test. They can go to work using, they can buy earmuffs, earplugs, or earmuffs. Mainly earplugs are what is recommended, because they only reduce the sound by 15 decibels, meaning that they allow for communication. However, it is very, very difficult, especially when you think about infection control. So it's neither here nor there. We encourage them to have regular screening, and if hospitals can have hearing conservation programs for these people, it would be best. I think I've answered the question.
Yeah, thank you, Dr. Ari. Apart from the infection control, I guess probably if somebody's an ICU staff, they should probably really consider taking care of their ears. Another question is on, are there any restrictions on the accessibility of hearing aid devices in Kenya? In the Western jurisdiction, these gadgets are freely accessible.
So there are no restrictions in the country. The problem is that the cost is very high. So because of the cost being high, these gadgets are not offered routinely in public hospitals. These services are not offered routinely in public hospitals. They should start being offered very soon as we implement our strategy. In the private, where they are offered, again, because of the cost, it is not all insurances that are able to cover for them. So again, it becomes very expensive for patients, and this makes them very inaccessible. And also the fact that there are very few healthcare workers who are trained to fit and program these hearing aids in the country. And so we definitely have very few people who can provide these services. And so this brings about the issue of accessibility.
Yeah, thank you, Dr. Ari. I have a 60-year-old relative who works at a posho mill and recently has been complaining of a sharp pain just below the right ear. Could that be a sign of noise-induced hearing loss?
Yes, it could be, but it could also be something else. I think they should go to an ENT healthcare worker, either a clinical officer or an ENT surgeon, so that they can get a better diagnosis.
Sorry, Dr. Ari, there was a time you mentioned the noise-induced hearing loss is on both ears. Will that be the same case for somebody who works in a posho mill and is not using earphones?
Yes, any person who is exposed to noise. That is why I said this patient should go to an ENT practitioner, because it could be, it could not be. It's because we do not discriminate which ear listens to what. We listen indiscriminately, and so exposure to noise to both ears is at the same level, at the same time, same frequency. So it usually is bilateral and symmetrical, the pattern of hearing loss. Yes.
Okay, great. Then another question from Morticia. There are these kids whom their hearing impairment is not known. You find them listening to high volume music. Can this worsen their eardrum, yet to them the sound is low?
So this is mainly people who already have a hearing impairment. I think in the deaf culture we have people who are hard of hearing. This is a category of people within the deaf community who have residual hearing that is usually just a little bit. Now these people find themselves listening to music at very high volumes and they're able to appreciate, yet they have a congenital hearing loss that leaves them with a very residual hearing. Yes, they should be educated on the harmful effects of noise because it does not make them special. Listening to music at that very high level is going to destroy that very little residual hearing that they have. And so they should be warned against this. So it is something that is practiced in the deaf culture. However, it is something that is it is a habit, or it is a lifestyle thing that we plan to change as we educate the deaf on even the deaf people on the harmful effects of noise, especially for that special category.
Thank you, Dr. Is NEMA aware of these guidelines? If yes, how do they license clubs, churches, and events with very high decibels?
Yes, they are aware of the guidelines. The guidelines are there for NEMA. They're also in the Constitution. There's a Noise Pollution Act. So these things are clearly there, but I think the problem is enforcement. So that is as far as I can go. But in order for us to be able to enforce, remember, we need to be aware. The public needs to be aware. The legislation needs to be aware. These people who are also setting up these clubs and these churches also need to be aware. And so what we need to do is create a lot of awareness and advocacy. And perhaps we are going to have a change even in those practices, whether enforcement is there or not.
Okay. Another question on that same area is WHO has NICE guidelines. Do we have legal frameworks to facilitate enforcement of compliance?
So that is the reason as to why we came up with the strategy. So the strategy is going, and the guidelines are documents that are going to anchor, or they are going to be anchored on other guidelines and policies that are available in the government, both civil policies, especially those ones to do with NEMA, and in the health workforce. So we are hoping that once they are all streamlined, then the enforcement might be something that will be done, and perhaps we'll start seeing a difference.
Okay. Then another question is on the mobile hearing apps. You mentioned earlier there are some mobile hearing apps that you can download. Is it a recommendation? Is it something that is recommendation to monitor the intensity of our noise? From George.
Yes, this one is recommended actually. It's one of the high recommendations. Everybody should have a noise measuring app in their phone. And this is for purposes of measuring the environmental noise levels. However, if you're not, and these apps are many, you can try different ones. I wouldn't recommend one particular one because there are all so many and they all do the same thing. They all have the same similar information. However, if you're not able to get an app, how can you tell you're in an environment where there is excessive noise? If you find yourself raising your voice, or find yourself having to shout, or if you find yourself having difficulty hearing a person talking to you, especially when you're in an environment where there's background noise, then you know that background noise is at a higher level than normal, and that calls for a reduction. So even when you're in the house, you don't need to use the app all the time. Simple things such as checking how people are talking at home. Are you shouting? Are you able to hear what the other person is telling you? Should be able to tell you whether or not you are exposed to harmful levels of noise.
Thank you. I hope people are going to download the app after this session. Yeah, I am a health worker working in educational assessment and resource center. We come across many types of hearing loss issues. Unfortunately, this education is not part of the community health volunteer module. What can be done to make this information reach school children quickly?
So we are currently in the strategy, we have created provision for training of community healthcare workers and integrating ear and hearing care into the existing resources for training of both the community healthcare workers, primary healthcare workers, medical officers, and that is even in the medical schools. So I think very soon these resources will be available and people can access them. And we are also making provision for school-based programs, both for hearing conservation and school-based screening. And we are going to utilize the EACs. We call them the EACs, the educational resource centers. And we are hoping that through them, that is one of the ways we are going to reach the community. So he should be a little bit patient. It is going to come once we disseminate to his county.
Thank you. So patience is key here. The awareness has started and it will slowly, in the next few years, decascade until everybody's fully aware. Daktari, there's a question here. At times I find myself having a sharp ear pain going for like 2 minutes. What might be the cause?
It's very difficult to answer, but if you get sharp pain when you're listening to music, either using your headphones or your earphones or earbuds or whatever personal listening device you're using, then that could be as a result of noise. Does not just damage the inner ear, it also damages the outer ear structures, especially due to the sound pressure. The pressure, sound is presented in pressure levels. So that can cause physical damage in terms of barotrauma, and that can cause pain. And so some patients come to us, especially people who work in call centers and they use mobile phones a lot or they use headphones a lot. They present with what is called acoustic shock, and pain is one of the symptoms that they come with. So it could be, but again, it depends on what the cause of the pain is. So I've answered in the line of noise-induced hearing loss.
Yeah, but probably you should get checked up, whoever's asked that question. I think that's better advised from Daktari. Then there's another person who also has a recent experience where they've been asked to receive phone calls and patients reminding them on when they're supposed to come back again, and doctors inquiring many questions about drug availability in the hospital pharmacy. Could this future predispose me to the risk of hearing loss?
Yes, the earliest diagnosis or how the diagnosis of noise-induced hearing loss came about was during the first industrial revolution, where we had a lot of people working and the factories were using boilers. So there were people who had a problem with, who had hearing loss as a result of working in the boiler areas. And the other people who also got a lot of hearing loss during that period were people who were telephone users. So the secretaries especially who are using the telephones in the call centers during that period are also among the first people to get noise-induced hearing loss. So yes, call centers, people who work in call centers are at high risk. If your daily work involves use of earphones, use of telephones, any of those personal listening devices, you're at an increased risk of developing noise-induced hearing loss. What you should do is regular screening and be aware of the signs and symptoms of hearing loss, especially the ringing, that is the tinnitus, and take frequent breaks while at work.
So when you should take frequent breaks that are quiet and minimize noise exposure in the recreational setup.
Thank you, Dr. So I don't know why I skipped the first question. How does sildenafil cause spontaneous hearing loss?
It's mainly to do with the pressures in the ear and the fluid shift. It is basically a physiological thing, and it is temporary, though it is not a common side effect, and it is not a permanent side effect. So it is due to the change in the ion particles within the fluids in the inner ear. That is the different chambers of the inner ear. I think it's a bit too complex for to break down. Yeah.
It's okay, Dr. At least we know guys who are using sildenafil for whatever reason, if it's pulmonary hypertension, even though it's not the most common reason why it's used, at least you know that you can actually get a hearing loss from it. Then another question on drugs. There are some patients who lose hearing following exposure to drug therapy, like long use of aminoglycosides. Any initiatives from departments to raise awareness of the same? And secondly, how can we help these patients?
So in the guidelines, we have made provision for ototoxicity. This is exposure from the common drugs. There's a list that is available in that same guideline that has the common drugs that cause hearing loss, those that cause permanent and those that cause temporary hearing loss, mainly as a result of ototoxicity. So they are in the guidelines. If the guidelines are disseminated, once they get to you, we also need to form, or we also in the process of forming educational materials that can be put in form of charts, that can be put in places so that they can act as a reminder to people about these drugs. So that is what we are currently trying to do, especially for the common drugs that cause a hearing loss, in terms of creating awareness and making sure people have the right information. It's available in the guidelines that will be disseminated.
Okay, Dr. So I'm going to switch kidogo to the hearing aids. There are many questions regarding that. One is about the noise that comes with it, especially in the elderly patients. And one person actually from the audience is saying they've been using it since 2019, and they've noted that they're starting to having bloody discharge with no pain. Is it something that is of concern, and how big of a side effect is that, or other symptom?
So if you're using hearing aids are fitted using a mold. The mold is like a custom-made earbud that usually fits into your ear canal and acts to connect the receiver that is inside the ear canal and the processor, which is outside. So generally, if you have a hearing aid, you're supposed to be friends with your audiologist, because you should go for regular fitting, you should go for regular servicing, and you should go for regular checkups. Regular checkups, because this particular mold can cause friction, it can cause pressure in your ear canal, and that can give you the wound. It can give you infections. Sometimes it can also get blocked. And so that individual, I'd advise them to go to hospital, let it get checked so that it can also be changed. Nowadays, also, if he was given an old-fashioned type of mold, it was probably made of plastic, which is a harder material that causes more trauma. Nowadays, we are making them out of silicone, which is softer and friendlier to the skin. So they should have that checked up and probably see how best they can avoid now the injury in future.
Thank you, Dr. Then there are some questions on where to get them, and where would be your recommendation for people to actually get these hearing aids, and also the earplugs, especially when they're going in matatus.
So the earplugs is the easiest. Earplugs are available. You can actually even buy earplugs in a chemist. You just say you want earplugs. They are available. Sometimes those people who are frequent flyers, there are airlines that give you earplugs. So they are commercially available. You can even buy them on Jumia. I think you can buy on Alibaba. They are everywhere. You can be able to access earplugs. You can also buy them from any ENT clinic. I believe most ENT clinics have earplugs available, especially the ones that can be used even for swimming. Now, there are some ENT surgeons, also some audiology clinics that provide the service of making for you a custom-made earplug. This is very good, especially because for an earplug to be effective, it has to create an airtight seal with your ear canal. And so you can also have that option of having it custom made in some audiological offices. Hearing aids, currently most hearing aids are available in private facilities, that is private ENT and audiology clinics. These are clinics that offer ENT services and at the same time hearing and hearing rehabilitative services. There are some in town. In the major towns, it's very difficult to find these services in the rural areas, hence why we are pushing for this. Currently in the government, there are no facilities that offer hearing aid services, but Kenyatta National Hospital should be starting soon. It is going to be the first center, it being the National Referral Center, to offer these services, and it is going to trickle down. By 2028, we aim to have at least 15 centers of excellence in each distributed across all counties. And these centers of excellence are going to be government facilities that will be offering comprehensive ear and hearing services, including fitting of hearing aids. So we are hoping that very soon hearing aids will be available in the public system. But for now, unfortunately, it's a service that is expensive. Some of the facilities that offer affordable hearing aids include Kijabe Mission Hospital. They have a program that sometimes offers, and the Kenya Institute of Special Education. For the Kenya Institute of Special Education, it is mainly a school-based program, but these are some of the places where people can get affordable hearing aids. However, there's a great need, there's a gap.
Yeah, and hopefully with the release of this new policy, we're very hopeful that a lot of things will change in the next coming few years. So there was a question regarding how do I differentiate between loss of hearing due to age and injury?
Loss of hearing due to age is progressive.
Due to age and injury.
Yeah, loss of hearing due to age is progressive and gradual over time, while loss of hearing due to injury is immediate and sudden after or related to the injury.
Okay. This is more of a comment, but I think the next disaster in hearing is the adolescent and young people using earphones almost throughout, even when they're crossing the roads. Maybe you can give your remark on that particular comment.
Yes, and that is why we did not forget school conservation programs, so that we start teaching them when they are very young, as they grow up, because it's very difficult to change adult behaviors. You know, the health belief model, if you look at it, if you want to change the health practices of people, sometimes you have to start advocacy at a very young age. And that is what we are doing. We might lose a generation in between, and that is why we are also advocating for availability and affordability and accessibility of these services, because if you look at the WHO projections, we probably have already lost a generation. And so by 2050, we will be having a considerable number of people with this problem, especially if we don't change our listening practices. So it's all about making it my responsibility, making it your responsibility, spreading the word, creating awareness, and doing as much advocacy work as we can. and hoping that if we start early, we will change the generation coming up.
Okay. Thank you. Thank you for that. And I hope we are not part of that generation, God knows. And
God forbid.
but even I'm sure there are a lot of parents in the forum. That's a take-home message for you to also share the knowledge with your children and your loved ones.
Yes.
How is partial deafness detected?
You definitely have to do a hearing loss. A hearing test to know or to diagnose or to detect a hearing loss. So it is detected through an audiogram, which is a hearing test.
Yeah, and today I can actually claim to read one with the dip at 4,000 hertz.
That is the easiest. Yes, that is the easiest audiogram to read.
Yes. So at least now when we see it, we know there's a partial deafness. This is just a comment from Barasa. Thank you for your great presentation. Just to add, the noise control and prevention rules of 2005 available online is a useful guide on noise in workplaces. We can familiarize ourselves with it as well. Is that a recommendation from you too, Dr. Are you familiar with the document?
Yes. These are some of the documents that are listed in the guidelines. So yes, we support it too.
Okay. Then a question from someone. I have a friend who has always had discharge on ears for the long time. Once given antibiotics, it clears, but it still comes back after a while.
That one, they missed the presentation on infections, but I would ask them to see an ENT. If you treat a patient for an ear infection and the discharge comes back, that is a reason for you to refer to the ENT.
Perfect. And in case you missed the session, it's being uploaded on our YouTube channel, so you can kindly check it there. Then autistic children, are there any plans for special children like those autistic who are hypersensitive to sound in a loud praying nation and market?
So for autistic children, this is a special category of children who are categorized as children with special needs. And these children also are a special category of children because most of these children, they do not talk. And so sometimes they are diagnosed to be deaf, yet they have a hearing. There are those who have, since it's a spectrum, there are those who are very sensitive to noise. There are those who are not sensitive to noise. And so for this special category of children who even would require long-term rehabilitation, we have a whole section on our guidelines on rehabilitation, and the rehabilitation we are recommended is an individual based form of rehabilitation that has a multidisciplinary type of approach. So depending on the spectrum where the child lies, if it's a child who is sensitive to noise, if you're followed up in a multidisciplinary rehabilitative center, then you will be given the earplugs or earmuffs, or the health care workers will give you ways or will teach you on how to protect your child from that harmful noise, especially to protect them from having an outburst or an episode if they are exposed to the harmful noisy environments. So this is something that should be tailored between the healthcare workers that are following you up and your child based on the specific needs of your child.
Okay, duly noted. This is a very interesting question. One of the audiences, they pass out every time they sit next to a speaker in a matatu that is very loud. Is that correlated? Is there any correlation? And I'm assuming it's with hearing loss.
Not with hearing loss. The correlation is the vagal reflex. As we know, there's a branch of the vagus nerve that passes through the ear, especially in the ear canal. So if you have sound that is very loud, remember I said sound travels in a pressurized form. Once it enters the ear canal under pressure, if that is enough or loud enough to
cause stimulation of the vagus nerve in the ear canal or in the ear, then you will definitely, you can find yourself getting a syncopal attack as a result of vagal stimulation.
Interesting. I've never heard of that, and it's a good exposure. I'm very sorry, but so what can they do to prevent such occurrences?
Nothing, they just protect themselves from noise. That is even it's even a protective mechanism for them. They should be very happy. But it is similar to the reason as to why we sneeze or cough when we are using earbuds. And also there are people who would go for syringing and also have maybe a syncopal attack. So it's all due to vagal stimulation.
Okay. Then another person has a case where they have a person who has been having left ear hearing problems since birth. Could this be correctable? No concerns with balance or any other concerns?
It depends. Different types of hearing loss have different modes of correcting. That is, can either be habilitative or rehabilitative. And yeah, most of the times, however, congenital hearing loss is one that needs habilitation or rehabilitation, depending on the time that it's diagnosed.
Oh, interesting. And I'm learning in this series, noise-induced hearing loss is rather unforgiving because it's not reversible.
Yes, it is permanent.
Yes, yeah, it's quite sad because a lot of us are actually quite exposed to it. So what do we do in our churches? We have no control on lighting and sound. And Daktari, just as a guess, not as a guess, but an answer to see if my understanding is correct. Would it still be advisable to use earplugs in this particular situation?
Yes. Perfect.
Thank you. Then please come again on the app you just mentioned. It's funny because I was actually reading it as APP, but yeah, Daktari, which apps were you or did you mention earlier on?
So I talked about the sound meter level, but it is not the only one. You can have there are many different apps. There's a decibel app. If you go to your App Store and just type sound meter, you will get different apps that can measure. They have different features. You can choose one that is best for you.
Okay. Some notes on, I was done FESS in 2014. When I board a plane, I have to stuck cotton wool in my ears and wear a mask, because if I don't, I suffer from severe headache. What can I do to improve this discomfort?
I think they should see an ENT surgeon. 2014 is a long time for her. FESS is FESS. It's a form of nasal surgery. And so it's best for her to see an ENT surgeon so that she can have it assessed properly.
Okay. Then doesn't age determine the threshold of noise that can cause hearing loss?
No.
Okay.
Age does not. Increasing age is actually a risk factor for hearing loss. However, what determines your baseline is that all of us are born with a biological baseline level. And this biological baseline level mainly depends on your genetical makeup, that is genetics. And then we have now those protective factors or protective things that you may have been exposed to in utero when you're developing in your mother's womb. And then now you have some harmful factors, like for example, there are people who have a less hearing because their mothers were given drugs that were ototoxic while they were pregnant. So that those protective and harmful factors that you're exposed to in utero together with your genetic makeup, are what leads you to be born with a baseline hearing level. Now, beyond there, it is up to you across your life course, whether you protect the ears or you expose them to damage, then your hearing loss will fluctuate according to what now you will be exposed to in terms of what you'll expose your ears to across your life course as you grow. And so you can have a 20-year-old who probably will have the hearing level of an 80-year-old, or an 80-year-old who probably never even went to a disco, and she will have.
I'm losing you, Daktari. Dr. Lilia?
Yes.
Yeah, sorry, I think we lost you a little bit, but we got you until the 80-year-old who's never gone to disco and hears better than a 20-year-old.
Oh, yes. So what I was saying is that we are born with a baseline biological level of hearing, and it is up to us to either protect our hearing or expose it to risks that will make it decline. So that is how hearing works.
Nice. So it has nothing to do with age, but it's more of exposure, if I'm understanding you correctly.
Yes.
Okay. Great. And then is there something like selective hearing loss?
No, what happens is that some people with a hearing loss, especially the ones with high frequency hearing loss, they're not able to appreciate certain sounds. And so they don't hear them. They're also not able to appreciate certain people. The example I gave of an old man who will come with a complaint of not hearing their wife. Don't dismiss that person. They probably have a high frequency hearing loss, and so they're not able to hear the high pitch from the wife's voice. So there's no selective hearing loss. It's physiological, but it presents in a way that looks like selective.
Okay, that's interesting. So in the interest of time, probably Dr. you can start giving us a parting shot. You've answered most of the questions. I think the rest are a bit, yeah. And just to note, a lot of people have asked about hearing aids and where it is found and everything. I think for those people who want to do NGO and stuff like that, probably it's an area you can think about. Yeah. Over to you, Dr.
My parting shot is simple. Let's limit noise exposure. Each time you're listening to something using a gadget, make sure the volume is at below 60%, and the duration of time you expose yourself is 60 minutes. So it's the 60-60 rule. Volumes always at 60% and below for 60 minutes and below. Simple.
Simple, but very hard to implement, and we shall try. So
yeah.
Sometimes the simplest things are the hardest to actually implement. So thank you very much, Dr. Lillian. As usual, it's a pleasure having you on the platform. You are a very good teacher. I hope you get that a lot from your students. And thank you everybody for listening in.
Thank you.
We have the questions on CPD are put there. The poster. KMPDC was going through a change in the system, so kindly bear with them as they are changing. So there will be some delays, but very exciting features that they're going to have, whereby you don't need to be uploading yourself; it will be done directly. Then for the pharmacy and poison board, we have uploaded all past sessions. Kindly subscribe to receive tokens for events you participated in. So in case you're having challenges, please again, reboot, check which email you're using, check if you have registered, who you have registered as, just recheck these things, because sometimes we might be thinking the problem is on our end, but perhaps you registered with the wrong email, or you probably said you're in the wrong profession. So we have many professions that we give CPD points. And somebody asked about occupational therapy. Hopefully we'll look into that, as we are looking into lab as well. So kindly bear with us as we strive to make this process easier and better for everyone. So thank you very much. Without further ado, I think tomorrow we'll be having a session in the blood symposium on quality management of blood. And take care. Have a lovely day. Bye-bye.